Sorry about that, guys. So, being called Spanish flu, it didn't come from Spain. I know that seems confusing, but there was a war going on, World War One. So, Spain was neutral in the war, and so they were not censoring their newspapers, whereas the U.S. and Germany and Europe, most of Europe, were censoring their newspapers. So Spain, while it was one of the earliest to be hit hardest, they were the first to write about it in their newspapers. So it became known as the Spanish flu in American newspapers. If you look at this map, it shows the first wave in orange and the second, much more deadly wave in purple. So look at that just to see how the virus was traveling. Remember, it was World War I. So we were sending troops over to Europe in big, big numbers, spreading the disease. This picture shows one of the symptoms of influenza, which is a blue face. See how his lips are blue and he's got a bluish tint to his face? That's from not getting enough oxygen because his lungs are ravaged by influenza. If you want to take a look at that YouTube video posted below, that would be a good idea. So remember, World War I. It ended in November 11th, 1918. The theory is that the stresses of combat and conditions increased the soldiers' vulnerability to the virus. Modern transportation, like ships, made it easier to spread the flu, and the flu had killed 57,000 American soldiers, which is 4,000 more than those killed in the war. So in total, a quarter of Americans got the virus, or 25%. This picture just shows some makeshift hospitals. Hospitals were running out of beds, so they had to make makeshift hospitals in areas that could support the room. So usually influenza kills the very, very young or the very, very old, but this one was different. This was targeting and killing the young and healthy. Half the deaths in 1918 were people between 20 and 40. The deaths occurred, so the theory is that their immune system, because they were strong and healthy, overreacted to the virus. It went into overdrive, and your immune system releases these chemicals called cytokines, and these cytokines cause inflammation, which makes you feel really, really sick, but it also kills the virus. Remember, most things that kill the virus will also eventually kill us. So these cytokines, they called it a cytokine storm, that it was trying to kill the virus, but it ended up killing the healthy. Whereas the old and young, their immune systems aren't as strong, so they did not develop these cytokine storms. Symptoms: blue tint to the face, coughing up blood, hemorrhaging. Deaths occurred in hours or the next day, so very quickly. October 19 was the deadliest month in U.S. history with 195,000 fatalities. It spread so quickly, healthcare workers became too sick to take care of the patients. And again, 50 to 100 million people were estimated to have died from it. The first wave was mild compared to the last two, particularly the second wave was the deadliest. These outbreaks occurred in France, Brest, Freetown, Boston, Massachusetts, and Sierra Leone. The third wave was in March 19 and spread in England and in Wales. This one just shows how many people died by country. India was just ravaged by it. And again, United States, about 600,000. So like coronavirus, we saw that the pandemic caused large business failures and stunted economic for years. People began to listen to authorities of public health. Research and testing is still being done today by recreating the virus. You'll learn about that in the podcast.